30 people for 3 openings, and I want you to wash my car. This is not why I busted my ass in med school.
We spent a half an hour cleaning the car, big deal.
It's demeaning.
Work is demeaning? We're too good for this?
I don't give me that honest day's labor crap. We all went to med school so we wouldn't have to do an honest day's labor.
What about an honest hour's labor? In exchange, we get a shot at learning from one of the best diagnosticians in the world.
No, we don't. If we did, we'd be one of the ones drawing blood or checking for toxins. We're done. He's just not gonna cut us loose until we've dusted his shelves and starched his shirt. I'm out of here. Who's with me?
Are we sure he wasn't joking? Maybe this is just a test.
Everything's a joke and everything's a test, and he wants us to do it. Come on, get up here.
I could try, but I pulled a muscle in 1987.
I didn't waste 2 years repeating medical school to be arrested and deported.
Why'd they make you repeat? Not enough gym credits?
According to the state of New Jersey, medical schools in my country suffer from not being from this country.
You know, if you get it open, you're gonna have to come down and let me in.
Or you could just wait out here. This is a competition.
Change your mind?
No,
Then why are you here?
never intended to quit.
Then why did you...
Intended to get everyone else to quit. Get off the car.
I need to clean it. We need to clean it.
I stole his keys. We'll take it to a car wash. He's got people breaking into a woman's apartment. Obviously, respecting personal property isn't one of the rules.
I told the super I was worried about my niece. She hasn't been answering the telephone. Nice guy. 2 daughters at Mount Holyoke.
We've started her on nitro and blood thinners. Electrolytes and post-arrest EKG were normal. The attack was not caused by the procedure.
So what does cause synesthesia, high red blood cell count, and heart attack?
Aren't we gonna discuss what caused the sudden appearance of burnt flesh? He brought charged paddles into an oxygenated room.
And you didn't stop him. Means either you thought there was a chance worth taking, making you a hypocrite, or you thought he'd fail, making you a cutthroat little pixie. What causes...
Takayasu syndrome.
Not without a rash and a fever. It's gotta be Whipple's.
No way. You ever see Whipple's without abdominal pain?
Stop it! This argument is distracting every male and lesbian here. You're both right, in the sense that you've convinced me that you're both wrong.
What about cardiomyopathy? Structural abnormality causes the heart attack and throws clots to the brain, leading to synesthesia.
How old are you?
I'm 21, unless it's relevant.
Okay, Scooter. Do a transesophageal echo. And since the positive divisors are 26 or 2 and 13, have them assist. The rest of you, go to the cafeteria, document 10 things that can cause infection, each.
The hormones stimulate your thyroid. Don't worry if you get flushed or you start to sweat. It means the thyroid's working. And if you want, I can remove that mole. I'm a plastic surgeon. You're allowed a little vanity.
I'm fine with the way I look.
Good for you. Although I do find it a bit odd that someone so self-assured doesn't want her doctors to find out what's wrong with her.
What are you talking about? Why else am I here?
You're jerking us around. You're handcuffing us with all these restrictions.
Feeling warm.
Her pulse is 120. Stop pushing. If House thought this would handicap us, he wouldn't have taken the case.
Or maybe that's why he took the case. He wants to see if we can get it out of her on our own.
What did you find at her home?
You were in my home?
Nothing.
Travel pictures, yearbook, her name on an employment slip?
We weren't checking for that stuff, okay? Obviously, House didn't want us to.
You're gonna out me, aren't you? You're gonna ruin everything.
Nobody's trying to do anything. Just relax.
This is not a normal response. The test pulse and BP are too high.
Get away from me. Get away from me. Don't touch me.
Page Paging me during Judge Judy, not the best way to win my affections.
She had another episode of synesthesia. It set off a psychotic attack, and now she ran in there and must have jammed something in the handles.
So you call me, the guy with one good leg and zero leverage.
We break that door down, security shows up, and her name goes in the file.
Luckily, violence is not the last resort. Extortion is. So go ahead, extort her.
If you don't open this door, we're gonna break it down.
Clever. An appeal to her deep concern for hospital property. Let's see how that works.
If you don't open this door, you're going to die.
Go away!
Seems to be getting to her.
She doesn't care if she dies.
Think she wants to die?
No, but I think she only wants to live under certain circumstances. Open up, or I blab your secret to everyone.
You don't know anything.
I do.
No!
Anybody think that a sedative might...
I'm trying.
Okay.
Who's that? Who is she?
Osama bin Laden.
Who is she?
Is she okay?
She's stable. Who is she?
What did House tell you?
That she is on the run from an international crime syndicate.
That's what he told us.
House may be your boss, but I'm House's boss. You want to work here? I better be okay with it.
Honestly, he didn't tell us anything about who she was.
Her
or
name's
what
Greta Cooper. Wants to be an astronaut, doesn't want NASA to know her brain's getting her ears confused with her eyes. I went through her mail.
You're a virus, House. Now, instead of one liability, I've got 20.
Apparently only 19. Which number was it?
From now on, everything you do gets charted. With pen, on paper, in a binder that says Princeton Plainsboro Teaching Hospital on the cover.
Mom!
If you want to run something through the labs, I get a copy. If you do scans, I get a copy. If you think about doing scans, I get a copy.
You know my current thoughts, right? I don't have to put those on paper. Three issues. 1, number 10, you're fired.
She told you?
Well, it had to be someone who went to her home. Number 26 is half asleep, missed his afternoon nap. Obviously, he doesn't feel guilt. Number 2 is here on a visa. She can't jeopardize...
You can't know.
And that chick's been pointing at you since I walked in. Issue 2. What causes synesthesia, high RBC, tachyarrhythmia, and panic attacks?
Slight blue.
When Bosley drags his ancient ass in there.
I'm here. 24-year-old funeral cosmetician suffered a grand mal seizure at work.
Why does he get to be Bosley?
You want to be Bosley? Bosley's like the asexual messenger boy.
She had a vision of being raped by a cadaver before passing out. Seizure rules out psychiatric illness. No history of epilepsy, head trauma, or drug use.
Bosley keeps his job while they replaced 5 angels over 3 seasons.
Could be a tumor to the temporal lobe.
Not with a normal CT scan.
You mean it appeared normal to the doc in the ER?
Way to get right back on that horse, 13.
No, that was Amber.
Nice try, cutthroat bitch. That was the worst 13 imitation I've ever heard.
Funeral home prep rooms are filled with toxic chemicals.
And cadavers. Everybody in that place obviously died from something.
I have a question. Is he the one who's not a doctor?
Bullets aren't contagious, but infections, parasites...
You said one of us wasn't a doctor, and you called him a fraud.
He's not a doctor. Continue, Boz.
Could be an STD.
Why isn't he fired?
Oh, you're breaking up. I'm going into a tunnel. Dark religious nut.
What did you call me?
I'm sorry. What do you people want to be called this week?
Cole?
I'm never going to remember that. Take Bosley and the other visible minority to the funeral home. The rest of you young white people, the world is your oyster. Do an MRI with contrast, EEG, LP, and blood panel. And angels, be careful.
Just because he's religious doesn't mean he won't kick your ass.
You want to bet?
No, I want you to stop being such a jerk to him.
$100. Smart call. Guy's a wuss. Give me the next one on the train.
Define kick your ass.
Any physical confrontation?
Or verbal?
Define verbal.
Anything over 70 decibels. And you can't start suddenly being nice to him.
You realize what you're encouraging here.
Yeah, someone kicking your ass.
Lesions aren't explained by Parkinson's.
Any theories? Ghost got your tongue?
I'm fine.
What about vasculitis?
MRI didn't indicate any cerebral ischemia.
But she has shown some focal weakness, urinary retention?
Yes, those are her big mystery symptoms, not the hallucinations that vasculitis doesn't explain.
Unless it's retinal vasculitis.
House, this guy may be smart, and I'm sure he's great to share a beer with, but if he doesn't know that visual symptoms are an electrical issue, not vascular, two separate systems...
So are the banks and the power grid. But if I don't pay my bills, my lights go out.
Vasculitis restricts blood flow to nerves, messes with electrical function.
Acute intermittent porphyria is a better fit.
If you're wrong about porphyria, the treatment could box her kidneys. Vasculitis is treated with corticosteroids. Relatively harmless.
Start her on the steroids.
House.
Then test for both so you can stop whining. Big love. Have I humiliated you in the last half hour?
No.
Check your email.
Enlarged spleen and liver failure are classic AIP. It's porphyria and it's moving fast.
PBGs were negative. If you read the report...
PBG tests are only conclusive if done during an attack, which you would know if you were a real doctor.
That is just great.
What is?
Which one of us is?
Both of you. Together. Fighting. Passionate to prove the other one wrong. Couldn't care less about the patient. Then all works out the same.
I hate 13.
Not as productively. Continue.
It could still be vascular.
Vasculitis is off the board. Steroid treatment didn't help.
Vascular isn't just vasculitis. Something's got to be cutting off the blood supply to her liver and spleen.
Do a visceral angiogram.
This is a joke, right? He can't be right every single time. You're feeding him your ideas just to embarrass us.
And if I wanted to embarrass you, I'd have you mop up the doctor's lounge.
Heavenly Father, I pray thee that thou shalt give the Holy Ghost unto all them that shall believe their words.
Irene, what are you doing?
I need to touch it.
Put your hand down.
No, give it to me. I want. Give it to me.
What'd the angio say?
We couldn't finish. She started groping me.
You couldn't let her get to second base just to get the test done?
I think that's third base.
She was convulsing, delirious, and hypersalivating. We had to knock her out with lorazepam.
Well, it's definitely not vascular.
What do you want us to do?
Question is, what would Joseph Smith do?
This isn't the time for
Casting out the demons?
The patient's not possessed. She's dying. You can mock me tomorrow.
You believe that the book has all the answers.
It's immorality, not science.
But the book is inconsistent with science. You know how many epileptics were tortured because they were possessed? How many teenage witches were stoned to death because they took mushrooms?
Just shut up already. We got a patient dying.
You either got to prescribe an exorcism or admit to me that Smith was a horny fraud.
I know what she has.
You couldn't have spoken up 10 seconds ago? You could have saved me $100.
Mushrooms weren't the only thing that got people stoned to death. Jimson weed, belladonna, mandrake root, and moldy bread. It's ergot poisoning.
You'd need damp grain.
Completely unprocessed and untreated, like what's in that organic rye bread she's been eating. Should I be going home?
Is it 6 o'clock?
It's why she got worse on the bromocriptine. It's an ergot derivative.
There hasn't been a case in 50 years.
She kept asking for milk. Dairy products counteract the effects.
You think she knew what she had and was treating it?
Cravings based on actual needs, it's a fairly common evolutionary development.
You okay with an answer based on evolution?
Yeah.
Hypocrite. As you know, there are 7 of you and only 6 roses.
Those are peonies. But I'm sure they're part of the rose family.
Actually, I'm surprised there are 7 of you. You punch your boss and stick around?
Give me the flower and shut up.
Don't overdo it. Now, I would love to keep all of you, but not enough to do anything about it. So, according to my arbitrary schedule, one of you has to go.
You're kidding. I came up with the answer. I robbed a grave. I
Planted a dog collar in the procedure room just to screw with my head?
No, I never.
But you don't believe she did it?
I'm sure she did it. That's why she's getting the flower. It was beautiful. She just overreached. She got into your head.
No,
She owned you. Planning the idea was good. Letting it fester was good. Leaving the collar was stupid. Well-known fact. Ghosts don't leave things lying around.
So am I gone then?
Oh, my goodness. I'd totally forgotten about you two. Well played. Sorry, Henry. He had some giggles.
You agreed with everything he said. You finished each other's sentences.
That's why I gotta go. Don't need someone to tell you what you're already thinking.
Funny, I was gonna say that. If you want to hang out.
Yeah, I know. Cole Wilson.
Rest of you, 8 o'clock tomorrow.
Cash will be fine.
Got a diagnosis yet?
Get out of here.
Got a stool sample yet?
How could you know?
Oh, I talked to a nurse. Pretty brilliant, huh? I give you a move House will love straight from one of his former fellows, and you let me join your team.
You're too late. We already have our diagnosis.
He's lying because he wants you to go away. So do I. How do we know you're not a double agent? Find out what we're thinking, then go back to the women.
Because I don't care what you're thinking. You want to know why I want to be on your team? Because you're idiots. If I can get the women out of the competition, I'm in. And so are 2 of you.
So, what's the big move?
It's called xenodiagnosis. We let these bugs bite you, and then we test their feces for parasites.
Why can't you test my feces?
Because you've been chugging milk and magnesia for the past hour. You got a lot going in and nothing coming out.
Testing the bug's feces is actually more accurate than testing yours. Smaller haystack, easier to find the needle.
You okay? Get the bugs off him. Get the bugs off him!
Test isn't done.
He's choking.
Blood pressure's remaining stable through 60 degrees.
No pauses on his EKG, no nausea. Our treatment worked.
I need our patient.
I think if he's cured, Amber, it's over.
You obviously haven't stressed the system hard enough.
You crank it up high enough, anyone will pass out.
It was incredible. This is the most I've moved in 20 years.
The tilt table test showed that the patient's EKG BPM pulse remained normal despite
Who are you,
considerable
13?
My name's in the file.
The fact that you want to answer my questions tells me more about you than answers could.
No, it doesn't. We turned the thing up to 95
Did
degrees.
non-answers tell me anything?
Sure, just not as much as actual answers. That's why they're called answers.
Tell me you're hiding something.
It tells you I'm hiding everything.
Tells me you got something worth hiding. Was it Turkish prison, gay porn? You killed a man just because he was asking too many questions?
Can I finish reporting on the patient?
No need. I'll see you in an hour or so. Gotta set some stuff up. Thank you all for coming to Tribal Council. A man of your integrity I feel I can trust. Big love. And I don't call you that because you're a Mormon. Where's your team's sixth man?
She went rogue, broke the rules.
You also sinned. You have no right to cast the first stone.
And atheists have no right to quote scripture.
The rules said no talking.
I told them not to talk.
Out loud.
We were trying to save a man's life.
Keyword being trying. Tilt table test confirmed that you guys were wrong. You're fired. The prodigal son returneth. You're also fired.
We thought there was a tumor on the patient's esophagus. We were right about the area, wrong about the diagnosis. Turns out the esophagus is just straightening. It's scleroderma. Explains the syncope and the choking. He needs steroids.
You did a CT scan?
Obviously.
After you were already proven wrong?
For you. It's too bad you're wrong. Straightening indicates weakening, not hardening. SMA explains the weakening. Strongyloides infection explains everything else. You ladies have the honor to give the patient a feeding tube, discharge him, show up for work tomorrow. The rest of you, you're a disappointment. You make me want to stop dangling.
Take something away. Took my walking. Took my modesty. Now it's taking one of my last pleasures.
There's an outside shot. That's something other than the SMA is causing your eating problems. And if it is, we can fix it. Remove that tube.
Is that my blood? It's green. What does that mean?
It means I'm not fired.
Is he a Vulcan? If no, what makes Nimoy bleed green?
Are we officially unfired?
How do we know she didn't fake the green blood?
Because that would be stupid. Well, she may be manipulative, borderline evil, shallow.
They get it. I'm not stupid.
What contrast did you use for the CT?
ICM.
His kidneys aren't working. They didn't filter the contrast, which in ICM is green.
10 points. Okay, let's add kidney failure to our list of symptoms.
What are these points? Is that how you're deciding who to fire?
I'm gonna fire the next person who asks me who I'm gonna fire.
Now we're on the point system? What happened to men against women?
Forget the game.
What do you mean, forget the game?
I mean, forget the damn game. Guy's kidneys are failing. We need to diagnose exactly.
I thought we were diagnosing.
You were diagnosing. Now I am too. I thought that 13 was right about the strongyloides. I was obviously wrong. Okay, kidney failure, aspiration, fainting, go.
Kidney failure could be the result of a gram-negative bacteria. Our patient wears a catheter full-time. It virtually guarantees bacterial infection.
Which could have migrated up to his kidneys. Infection stresses his already weakened system, makes his SMA worse. That explains the choking and fainting.
Put him on an IV Ampijet.
Our team's scleroderma diagnosis still holds. The test could have been negative because the blood was tainted with contrast.
Do a skin biopsy. Get a side of lymph node to confirm. I can have it.
Okay, I got it.
Can you get Hoover? I can't. Can you put my hand on his head? It's okay. Don't worry. I'm not scared.
Oh, God.
He's dead.
There are only a handful of viruses that can cross between dogs and humans, but they may not be connected at all. The dog was old. I've seen it before. They hang on way past their normal life expectancy to take care of their masters.
Did you watch him take the pills? The ivermectin, did you watch the patient put them in his mouth and swallow them?
I don't know. I think so.
What kind of dog is that?
English Shepherd.
It's in the collie family, right?
Not really.
They share the MDR1 gene.
Yeah.
What happens when you give a dog with the MDR1 gene ivermectin?
They don't. I mean, it's used to treat heartworms in most dogs, but it'd be fatal if the...
Look familiar? I think the last time you saw it, it didn't have that dead dog's teeth marks on it.
I just put it on the bed tray to get him some water.
When I asked you if you watched the patient swallow the pills, the right answer was no. Take his body down to the morgue.
As soon as the pathologist cut into the lungs, we saw the threadworms.
You think it's fair that I fired all the other members of your team when you guys actually came up with the right diagnosis?
I keep replaying it in my mind. Did I drop the pills when I put them on the bed tray? Did I knock them over when I turned to leave?
You know he'd be alive. His dog would be alive.
I know.
You forced us to act on a false assumption.
I know.
Everything we built from that step on. Every test, every theory, every treatment.
I know. Forget the lecture and fire me already.
If I was gonna fire you, I wouldn't be giving you the lecture. I know you're not gonna let anything like this ever happen again. I'll see you tomorrow. I'm sorry to say, I told you so.
We think it's Miller-Fisher, an inflammatory process. In rare cases, it can cause respiratory failure, but...
Wait, she could stop breathing?
You said there was nothing wrong. You said you were sure.
We just had another seizure. Clearly, there's something wrong.
So why should I trust you to figure out what it is? Where's Dr. House? I'm at this hospital.
It's gonna be all right. We just need to start the plasmapheresis.
No. It's not going to be all right because you obviously don't have a clue what you're doing. I'm not letting you touch me.
Honey,
I want to see House. Where is he?
What do we do?
I don't know yet.
She needs treatment.
This is a test, right? You're reporting back to him everything we do.
Yeah. And I asked the patient to be uncooperative. Personally, I think she overplayed it.
She's being uncooperative because you made us all look like idiots.
We're only gonna look like idiots if we can't figure out how to get her to agree to the treatment.
What would House do right now?
Pop a pill, insult us, and trick the patient?
We can do that last part. She's never met House before, has she? Who's got a cane?
House isn't here. We're not gonna act like him.
What do you want?
I'm gonna do what doctors aren't supposed to do. Admit I made a mistake. I shouldn't have been so quick to dismiss your symptoms. But you need to let her start the plasmapheresis.
What do you want?
Case? Honey, do you know where you are?
She's burning up.
Start the treatment.
We can't.
You've got my permission. She's obviously confused.
It doesn't matter anymore. Miller-Fisher doesn't cause delirium and fever. I don't know what this is. Fever and delirium rule out. He's not gonna hire you just because you call him the most. Especially since it's obvious he doesn't want to be called. Symptoms rule out Miller-Fisher. MS fits better.
Progression's too fast, more likely meningitis.
Areflexia doesn't fit as well with...
Does with amyloidosis.
That's even slower than MS. It's lupus.
I'm with the little man on this one. It's attacking the body and the brain. Classic autoimmune.
Flirt all you want, but I should warn you, Shixes are for practice.
Lupus this aggressive wouldn't spare her kidneys. It's primarily neurological. Let's start her on...
Why no plaques on her MRI?
Well, the MRI was inconclusive. Start her
So
on...
now you're sure that it's MS. Just like you were sure it was Miller-Fisher an hour after you were sure it was heat stroke.
The symptoms fit. Start her on interferon.
We're not going to score any points with House if we solve this just by running your errands.
I get that you want to be right.
You don't?
I'm just trying to save a patient, not score points with my boss.
Would it hurt the patient if you let us run some tests?
You've got 3 hours.
Paralysis. It's a new symptom. Big white space on the board where it would fit. Nice multicolored markers.
I'm not writing it because we can't know if it's a real symptom. And these two went rogue and pumped her full of steroids.
Steroids don't cause paralysis.
She was also on interferon. Giving her both probably fried her immune system. Who knows what infection you could cause?
We consulted an immunologist. She said we have...
You talking about Dr. Cameron?
She thought lupus was
She tell you to start treating?
Yes, they've ignored you. They screwed up, and it's fun watching you spank them. But can we get back to the medicine?
The last thing any of you give a damn about is the medicine. Look, I'm not saying you're bad doctors or bad people, but House is. He created a nasty little cutthroat world, planted you in it, and is watching you play. And none of it works for anyone except him.
And whoever wins.
Given its quick progression, we gotta assume botulism.
I'll go to her place, check out her fridge and pantry.
It's not botulism. It's polio.
Brilliant. We should search her home for FDR's remains or a time machine.
She could have contracted it from anyone who's been to Africa.
She's been vaccinated.
Vaccines wear off.
There hasn't been a single American case in over 20 years.
I've seen this disease. I know what it looks like.
That's why you're finding it, because you're looking for it. Polio, it's crazy.
House wouldn't think so.
So go find House and tell him your theory. Take a personal day. Seriously, get out of here.
You don't have the power to fire me.
But I do have the power to kick your ass off my case. I'm starting the botulism treatment. The rest of you look for confirmation.
He should be brought up when...
She's getting worse.
Fever's risen slightly.
But it's definitely with botulism, right? Because if you're wrong again, and you're treating her for something she doesn't even have.
The antitoxin hasn't had time to work yet. I know it's hard, but try to be patient. Excuse me.
I know you're pissed. I interrupted, but you're gonna be even more pissed in a second.
You tested her without telling me?
Yeah. I know. I'm really, really sorry. But on the other hand, it's positive. She has polio. Now what, boss?
Sorry. I was stubborn and arrogant.
Self-recriminations won't help her.
Nothing's gonna help her. She's got polio.
There's no cure, but there are treatments.
She's dying.
Yeah, every death's a tragedy. Funny how you weren't so depressed when she was just dying because me and Amber screwed up.
And I'm also self-centered. Thanks for clarifying.
Don't forget self-pitying.
Vitamin C. Extremely high doses. It was experimental treatment protocol in the 50s.
And they haven't finished yet?
They lost funding.
It's because there's no logical reason vitamin C would cure polio.
Well, someone thought there was.
Someone thought black people made excellent farm implements.
I'm not talking about hurting anyone. I just want to force feed her some orange juice.
You don't want to throw in some bacon and eggs as well?
If there's anything you learned today, it's got to be that you can be wrong.
Why is she shivering?
Low serum calcium is a side effect of the treatment. I can give her a calcium supplement.
My arm hurts.
Infusion rate has to remain high for the treatment to work.
Is it working? You feel that?
Yeah. It hurts.
It's working. This is fantastic.
I told you can't cure polio. Means either she's not cured or she never had it. Since she's walking out of here. Tested her blood from admittance. No polio. Means Brennan screwed up the lab tests.
Or you screwed up your lab tests.
You must have. She got better.
So it's relapsing and remitting. Maybe porphyria.
That's a stretch. She had porphyria. You've seen purple urine.
You think it's more likely he cured polio?
Well, they believe it. Her symptoms fit perfectly. And the alternative is unbelievably convoluted. Some doctor would have to poison her with thallium so it looks like polio, then fake a lab test, then give her vitamin C and stop the poison so she magically gets better. Actually, it is kind of doable, right? So what do you think? Should we test her for thallium before you contact Stockholm?
You poisoned her?
Really shocking thing is that Foreman was right about the heat stroke.
Vitamin C cures polio. I've seen it.
Yeah, some bush clinic. You needed polio in a place with a proper lab. The only problem is that places with proper labs don't have polio.
There is no money in finding cures for diseases that only kill poor people. This will make them do research.
What do you care if I faked a lab test if it saves a few thousand lives? I did what I had to do. Isn't that what you hired us for?
Which is why I'm not gonna fire you. You're gonna quit. Go on, get out of here.
So you're just gonna let him go?
Absolutely. I'm gonna let him get as far away as possible before you call the cops.